So good morning, welcome. Thank you for joining us to this panel. So the title of the panel is Unlocking Health Data for Global AI-Ready Systems. Sorry, that's the event. And we are going to focus on data, right? As I said, I do believe that AI revolution is above all the data revolution. And the AI promises depends entirely on how we can operate this revolution on data. So it's not very good news because it's very hard. It's a very hard revolution to operate, right? It has some major roadblocks. To name, let's say, 4 major roadblocks, I would name data fragmentation. Data are everywhere. In any hospitals you have data, so it's very hard to understand where is what and to gather them. Data quality and interoperability, so they are everywhere, but they were built differently, so does it make any sense to put them together, which is a very tough question. Regularity, complexity. We know today that it is hard to get access to data. Hopefully, EHDS is the solution to that, but it will be discussed during this roundtable. Access and equity. If only a few companies or countries control the best data, will AI-driven healthcare benefit everyone or just a select of few? So this is clearly the goal of the European Health Data Space, the EHDS, is to try to address all these major roadblocks and hopefully to bring solutions that will work. So Lorena already talked about it. I'm not going to talk again, and we are late, so I will let the speakers also talk about the European Health Data Space, right? But it will be at the center of this first roundtable. So if you agree, I will structure this panel in 3 rounds of discussion. First, we will define the fundamentals. How does EHDS enable AI and what's missing to make it work? And could it scale at a global level? The second round will dive into the real-world challenges. What concrete steps are needed to make AI-ready health data a reality? And the third round of questions of this roundtable will confront the big tensions at play: regulation and innovation, public-private interest, Europe's place in the global AI landscape. So to start, let me start by the fundamentals, so the first round. And if you agree, I will briefly introduce each speaker in turn and ask him a couple of questions. And I will start with Marco. Marco Marsella, welcome. Thank you for being with us. Marco is Director of Health Systems and Digital European Commission at DG SANTE. So my first question for you, Marco, so AI needs data. Does EHDS deliver what AI truly needs? Is it a game changer for health data access?
Thank you, Emmanuel, and good morning, everyone. Well, certainly the Commission, as Lorena mentioned before, invested in the regulation because we believe that that's exactly the main output that we would expect, and we need to facilitate. This regulation doesn't come, on a vacuum. It comes because we matured an important number of experiences, especially, I say, amplified during the pandemic, when we realized that we needed data and we did not have access to that data. I think that we are, well, you mentioned the fragmentations. We are all aware about the issue of interoperability of data. We have been discussing about years about fixing the interoperability matter. But again, when we need it, we didn't have. We didn't have, and as you rightly say, it's not only just a matter of having access to data in a way that is interoperable, we also need to be clear on the quality of that data. And if it is true, as it is true, and Lorena stressed a lot that point, that to get quality AI, you will also need quality data. Well, that this is the line of thinking that we have been, together with the stakeholders, following to draw a regulation that would enable that kind of innovations. And why are we saying that? Because, well, first of all, there is a Copernican revolution in this space. For the first time in health regulation for data, you have two pieces together. You know, health in general is Ministry of Health, and they take very much care about my health, Marco's health, also community health. Now, for the first time in these regulations, we put together access to data from a citizen's point of view and access to data for a community point of view. That is the differences that we use to refer technically as primary and secondary data. Now, if we look at AI, certainly one may think that the first point would be the secondary use of data, so the fact that we do have a large, very diversified set of data fragmented across Europe. Fragmented means in different national systems, in different formats, in different data sets. Well, then that's where the European Health Data Space kicks in. Now, we are not going to change the way in which the data is stored today, but we're going to fix the way of exchanging that data through one single set of standards, UNO, which means that I can package the data, send it to somebody else, n'importe pas, where he is in France, in Italy, or in Estonia, and she will be able to unpack, read what is in there, and understand what is there. Now, that's the first backbone, and which we call the European Electronic Exchange Format. Now, once we have done that for certain categories of data, we also need to be, say, innovation-oriented, facilitating the access of researchers and innovators. And that's the second, say, Copernican revolutions. We will establish one set of rules for accessing that data in environments that are secure to guarantee trust. But most importantly, the researcher will not have to deal with 27 different legal, underpinnings. He just sent one request for one project, which will be assessed all over Europe, and the data will be gathered all over Europe from all data sources, as stressed in Lorena's speech. And then when we consolidate, this will be given in a format that can be used by those who develop AI for developing that technology. Now, why is this a Copernican revolution? Because it tries to fix, one, the fact that I, as a citizen, I have access to my data to cure myself, and it also helps the community to create better technological solutions for helping all of us.
Thank you very much. Marco, let me move to Joni Komulainen. I'm sorry if I mispronounce your name. No, it's okay. Okay, I'm good today. So Joni is Senior Ministerial Advisor, Ministry of Social Affairs and Health in Finland. So we have been talking about data sharing, so it's great, but we all know that garbage in, garbage out, so data quality is very important. And do you think Europe, or let's talk about more particularly maybe Finland as an example, has enough high quality AI-ready health data?
Thank you, Emmanuel, for the good question, and thank you, Marco, for the excellent comments as well. And I'm just happy to be here now that we have had the AI Act. Okay, I have been fortunate enough to take part in the negotiations of the Council of Europe Framework Convention on AI, reflecting the human rights. So we have that, and on Thursday we will be signing the ESDS regulation as well. So we have 3 building blocks coming. So I'm really happy about this, and thank you for the Commission for the excellent work regarding these regulations. And Council of Europe, of course. Regarding your question, a lot of countries, like the Nordic countries, have been doing a lot of work in order to get high-quality data sets. When our national legislation was published back in 2019, Politico interviewed me and we said, we have high-quality data, and even I was mentioning that we have diamonds that you could just pick up, and that's not really the case. Okay, you may have coal that could be raffinated into diamonds. So yeah, we may have garbage, and some countries may have garbage, but a lot of work is done in several member states, And initiatives like the ESDS will certainly make sure that in the future we will definitely have data sets which are hopefully of high quality. And not just that, doing that, and of course that work needs, you need to have a lot of resources in order to do that. So that's one of the challenges, of course. In order to have high quality data sets, you have to pay a lot of attention how data is registered. You have to have the resources, you have to have the time to register the data. But even with the registering the data, when a healthcare professional is doing that, or other kind of professional is doing that, you could use AI for the registering of the data. And that's being done in many countries like Finland at the moment. So you could make sure, even in the part where you're registering the health data, that it will be of high quality and use AI tools for doing that. So that's something we could do. Because otherwise, what the situation is at the moment, if the doctor has time, like for example, 30 minutes for the patient, 15 minutes is used to register data, and that can't be the case. So there are actually tools that we could utilize that we wouldn't be having garbage. To start with, we would have high quality data sets. But yeah, initiatives are done in many countries, and certainly the building block for Europe will be the ESDS. Thank you.
So let me ask a second question as far as Finland is concerned. So is EHDS the right answer? Be careful, you are watched. So be careful with your answer.
Of course, it's the right answer. It's the right answer because, I think it was mentioned by Marco that, what the situation was before ESDS. We were starting to have 27 different health data spaces. And if you want Europe to have the competitive advantage, it can't be so that we have 27 different health data spaces. It just, it's impossible. And sharing between countries would be completely impossible. But, the way forward is to do cooperation with the different member states. And countries like, for example, France and Finland could be helping other member states to make ESDS happen.
Okay, thank you, Joni. So now let me move to David. So David Novillo Ortiz, you are the unit head digital health at WHO. So it's nice to have you with us. So my first question for you would be, Europe is creating a structured AI-ready health data space, but is this model scalable globally? Could we ever see a world health data space, or are the barriers too high?
Thank you so much, Emmanuel, and good morning to everyone. So what I'm going to be sharing today in this panel is based on my experience from the Spanish government, moving to the Americas region, leading the digital health portfolio in the Americas region, and now working in the European region, which covers 53 countries in this part of the world. Let me start with some data, and Lorena pointed this out very rightly. The main problem that we are facing at the moment is data. So we are talking about artificial intelligence. Of course, we need to move because we are lagging behind. So how we can get there, right? Let's go to the basics. If we go to the Sustainable Development Goals, for example, I'm pretty sure that you have heard about the Sustainable Development Goals. So we have been looking at the availability of this data, right? Particularly in health. So we know that there's approximately 43 SDGs that are health-related, beyond the SDG 3 that is focusing on health. So we have terrible news, right? When you're looking at the availability of this data, 30% of these health-related SDGs are missing. But also when you look at the timeliness of this data, only 20% is from 2023. So we have a data availability problem and also a timeliness problem. We have learned a lot during the COVID-19 pandemic, and we need to still continue talking about this, right? I was myself from the field trying to lead missions with countries, and we saw all the problems that we have with data, right? Just looking at the health data standards, how it was defined, calculated, the formats of the data. That was a real challenge for all of us at the global level. But also the delays in receiving the data, that was also a main problem. But also the problems about interoperability that we expect that with the European health data space that is going to be now addressed, and it will move faster. And also a problem about the culture of the users. We don't have people trained to work, to manage and use data. So this is the reality when we are talking about data. If you're asking me, Emmanuel, about this could be scaled globally, I think so. I mean, with that first negative note, I am very optimistic. And we have seen how the EU COVID-19 certificate was very successful. That now, this has been thanks to the Commission, and particularly need to thank Marco, that he was the architect of this initiative. Now it's the Global Digital Health Certification Network that is trying to have this global interoperability, right? And about how we can continue supporting countries. I think that Lorena also mentioned, we need to continue developing or enhancing the health data governance. That is something that we are not doing enough. But also to have well-documented data processes, even manual or electronic. As I said, with a huge overview about working with several countries, we need to remember that there are countries still paper-based, and that is also a reality beyond the European Union, right? Also about exchange of data, and then to continue promoting these users and these skills that are missing in the health workforce. But going to the initial point about, is this possible? Yes, I think so. Thank you.
Great, thank you very much. So now let's move to Eric. So Eric Sutherland, you are a senior health economist at OECD. Thank you to be with us. So my question will be about equity. Equity is a major subject. How do we ensure AI in healthcare and, of course, EHDS also doesn't widen the digital divide between well-resourced and under-resourced health systems?
Well, I think so. Thank you all. Thank you, everybody who's been speaking so far, and thank you to Lorena for your opening remarks. Thrilled to be here, and I believe that the equitability of the next phase of healthcare is one of the most biggest risks, even existential risks that we have. We currently have a massive digital divide as implementation of digital tools have happened around the world. We are at great risk of those divides expanding to untraversable canyons unless we make conscious decisions to prevent and ideally close that divide. Now, that divide occurs in 3 different areas. One is around the data. We've heard enough about data this morning, and I roll my eyes, but not really. The OECD, we published documentation around the importance of health data governance almost 10 years ago. We've been in that space and really encouraging both the protection and, importantly, the use of data for various decision-making. So you guys know 30% of the world's data, to put a number on the size of the problem, 30% of the world's data are in health. Health uses 5% of its data for decision-making. So we are not using more than 25% of the world's data assets for public interest. That feels negligent. And importantly, in a world of equity, how do we make use of that data for the public good? And that's where things like the HDS, I think, are important. So we need to make sure that we have meaningful access to the data to drive our systems. Secondly, from an AI perspective, we need to make sure that the systems are designed with an equitable outcome in mind. The people, the developers who are designing these solutions can embed their personal biases into their algorithms, into the AI systems, in order to achieve unequitable results. That is a matter of ethics, and there's some work that's happening around declarations to ensure an equitable application of these systems. But then the third point, I think that's where you were going, Emmanuel, that the access to these systems is enormously difficult. Practically speaking, very wealthy institutions who have both financial support and risk appetite are investing in these solutions, largely in large urban centers. Rural areas are finding access to these systems to be extremely problematic. And especially when we think about the global north and the global south, that even becomes a greater divide between the two. So how do we take intentional action in order to address those barriers of the accessibility of the data and the accessibility of these tools and technologies to the people who need them most? So that said, the challenge that we have is AI itself doesn't care. It is a tool. It's a stethoscope. That's all it really is. It is about the people who are making conscious decisions about how to provide access to the data, how to develop the solutions, and how to deploy the solutions to the people who need them. And that is an issue of culture. And so it's interesting that I really drive the question around equity to an issue of culture. And the challenge is much of our culture is designed around the prevention of negative things from happening. But in so doing, we're also preventing good things from happening. We need to shift our mental models from around how we can prevent bad to how we can prevent harm. And preventing harm means preventing both the actions that create bad and the inaction that creates bad. So we need to shift our overall cultures from this mode around just simply, if I can put it this way, around protection to use and protection. And we have to do that. And if we do that, then we can actually use the data, use the systems, and use the solutions in a way that can drive equitability if we have that as one of our shining golden stars that we're seeking.
Thank you very much. Yeah, we talk a lot about the risk to share the data, but there is a huge risk not to share the data. This is something we don't say enough, I think. So let's move to our next panelist. So Bakul, thank you, Bakul Patel. Thank you for being with us. So Bakul, you are a senior director at Global Digital Health Strategy and Regulatory at Google Health. So you are the person that represents industry on this panel, right? So can you give us the industry perspective, how industry uses data, and how will EHDS impact AI development in healthcare?
Yeah. Thanks. Thank you, Emmanuel. Really, really happy to be here, and I think I would 100% agree with Eric's position. And the concept about EHDS is phenomenal because I think it just opens up that first layer of access to data that will free up a lot of applications that's development. I think from an industry perspective, as you can imagine, research in AI is happening a lot more in industry as well, in addition to what's happening in the universities as well. So I think that research to product or research to application world is really where a lot of companies are focusing on. And the fuel for that is data, and which is where EHDS can sort of be helpful. But let me tell you, like, where I have seen where most energy has been spent in using the data. Access to data is one thing. And then you start thinking about when you're about to train a model, how do you label the data? And when you start thinking about those steps, you're no longer that level of just, now you have access, now somebody has to label it. And can you imagine every person who is building a product has to go through that same thing? So there is a level of inefficiency that sort of exists even when we go from access to actually creating research to creating a product that can be used in the solutioning. So that's like one problem statement that we haven't quite solved yet. And I feel like everybody is trying to duplicate the work again and again and again. So if there's any opportunity for us to start thinking about how that could be leveraged, I think would be something that would be important. I also feel that, you know, interoperability and value to patients who are sharing the data is also a question that we've seen more and more come up. When you start thinking about government officials or countries sharing data, but where's the value going at the end of the day? It's not just about transaction to money, it's also value to the patients. And I don't want to imply there's a monetary value, but it has to be a return value for the patient saying, your research contributed to, your data contributed to this research that ends up in this solution that helped so many people. We are not tracking some of that stuff. And it is a longitudinal problem and not just about public or private issue. I think we need to figure out as a community what we need to think about from that. And I think I want to touch on a couple things about scalability. I think talking, when David mentioned about scalability across the globe, I feel like this model of data exchange concepts that exist in, I said, over-resourced countries cannot be replicated easily in the lower resource country. So I think there's, probably a way to sort of get folks like WHO to start thinking about what should that start to look like. I mean, if I get data from the European Union, and then you end up labeling it, but how does it represent the people in Nigeria or Kenya? It's still unknown. And I think this is where Eric's perspective is really, really important to sort of highlight, is this concepts of data scalability and generalizability for information that's been trained with is going to get an important issue that will divide further, if not designed into the thing. I think you're looking for another question, so I'm going to pause. He's got the microphone on. So.
No, I had, but make it very, very short. According to the HDS, industries will require to share the data. Mm-hmm. So how do you see that? How it will work? How does it impact you, or how do you see it work?
Yeah, I think access is one of the key things that's going to matter. I think sharing data that takes care into the intellectual property for companies, I think it's going to be very important to think about. Each company will differentiate themselves with their intellectual property in how they use data to create value. And I don't think we need to systematize so that we have a race to the lowest denominator. I think we need to allow companies to create more value, giving them freedom to sort of create intellectual property, but the foundation data set, which EHDS like systems can provide, is going to be the fuel for that.
Thank you. So this was the introduction round. So now I want to start the second round, which is about going from blueprint to reality. What will it take to make AI-ready health data work? So how does the EHDS potential translate into practice? What are the missing pieces that need to be in place for this to work? And I will ask some questions to some specific panelists, but don't hesitate to interact one with each other, right? So I will start again with Marco. How can we build and leverage on the EHDS framework, and how can the EHDS act as a facilitator for the use of responsible AI?
Okay, so let's start with the facilitations. Well, the first thing is that the fact that you have a regulation doesn't mean that tomorrow morning you will be able to share the data. So there are strings attached to that regulations, which means that we have to put in place the right digital infrastructure in addition to the piece of regulation that regulates, by the way, very well the kind of access to data. So what you can do and what you cannot do with that, and who can do it and who cannot do it. So that's already the first piece. So I would say the first thing to mainstream that regulation is to get totally acquainted with its provisions the moment it is published in the official journal. The second thing, once you have the rules set, you need to have the digital infrastructure that will help you do what you want to do. So first, say if I take Estonians and Finnish, they are today already voluntarily able to exchange an e-prescription, right? So if I go in Finland and I get an e-prescription in Finnish, I can go to Tallinn and get the drugs delivered in Estonian. Now, to make this happen, you have to have something which legally translates what it is delivered in one country and read in another country. So that is the role of the European Commission in the context of the European data space. We will be building, well, we have it, at least for primary data, we do have already a backbone that allows the secure exchange of data between two countries for personal, say for primary use, no, for me. We would need to do the same thing for the exchange of data or access to data, it's not exchange, access to data for secondary use. So between the day the regulation is published in the official journal, for the first 2 years, we will be working the technical specifications to create, for instance, the processing environment that will allow the secure processing of data. We will define the technical specs to have one query only and then one data set back globally in a federated way. This will take something between 2 years to 4 years. And we really rely on I think that we know how to do it. And we know how to do it because we have experience in delivering large infrastructure, and they work because everyone engages into it. So, and it's not just a matter of the governments. Here it needs the researcher, those who create data sets that engage in the rules and in connecting to these technological solutions.
Thank you. So if I would like to switch to Joni now, and maybe rephrase or what you said, Bakul, about incentives. Incentives is very important. So at the national level in Finland, what are we missing maybe? What are the missing links to operate all that? And are we missing incentives for sharing data or for making AI-ready data sets? And not talking only about industries incentives, but also incentive for the scientists and for the data producers and so on. So if you can talk about your experience about that. And Bakul, of course, if you want.
Yeah, thank you, Emmanuel. Thank you, Marco, for explaining what we need to in order to implement the ESDS. Just to refer to that, when you look at the ESDS, it's pretty much what we have in Finland regarding the primary use of health data, what we have been doing for a long, long time. And the use cases that you mentioned is precision we have been doing with SNL since 2019. So it's not a new thing to us, but it's building on that fun foundation. And the secondary use part as well is sort of like a spitting image of our secondary use act as well, but loads more possibilities. So what is needed in order to make this happen? I have mentioned this many times before in various events, the incentives. There are actually 3 different parties that are essential to make ESDS happen. Regarding the secondary use part, it's definitely the health data users. It's those people, for example, we'll build on primary use. It's those people who register the data. I mentioned what's their burden at the moment, and they could utilize AI solutions, for example. And those health data holders, who are the health care providers, they need to have enough resources, enough funding, incentives in order to produce the high quality data that's to be used for the secondary use purposes. So definitely you need to have the health data holders. The health data users, they need to learn a new way of doing things. It won't be a walk in the park, because it will be a new way of doing things. They gain a lot, but it's a new way of applying for data, and not all of them are aware of how to apply for different kinds of data sets for different kinds of purposes. It's a new thing for them to have SPs, the secure processing environments, and it can be done. Like in Finland, in FinData secure processing environment, even at the moment, AI models are being trained using health data, and that's health data, or we have social benefits data, we have socioeconomic data as well. So in the secure processing environment, AI models are being trained at the moment, and AI is used for secondary use purposes, like scientific purposes. So you definitely need to have health data users, health professionals, health data holders, to get to know the new process of the new way of doing things. Then the health data holders, the health data users, and of course the health data access bodies. It's something that you need to build. But it all starts from the registering of the data. And regarding the previous question, I was thinking of that as well. I mentioned, there are AI tools in order to help the registering of data, but there are even AI tools that could try to make the garbage into something not that garbage. So there's 2 ways of using AI in the registering the data, but then when it's collected and combined, that's sort of garbage to make it more useful. So that's possible. So there are definite incentives, and I think the great thing is there are a lot of incentives coming from the Commission and lots of funding opportunities, and I encourage member states and you experts to utilize the incentives and the fundings that is coming from the Commission. Thank you.
Bakul, maybe you want what would be the right incentives for industry?
So I can draw parallels, right? So folks are aware of the meaningful use criteria in the US that basically incentivize providers to use electronic health systems. Was a great mechanism for giving people a incentive to say you will get paid for your service if you use electronic health records. I think we can use something very similar that from that aspect to saying if you share data, you get X for your service provider, and if you're researching something, you give back something. So there is this mechanism for everybody who's benefiting from it can actually provide value back to the people who are producing it. And I think this is a concept that we could explore, because at the end of the day, if you make the life easier and some safe path to value for doing these transactions, I think we are actually going to be successful. And creating the least path of least resistance is really what the idea is.
And maybe I'm mistaken, but Marco, the HDS doesn't allow making money out of accessing to health data, right? So there could be financial incentives, but just to cover the cost, right?
Yes, it is regulated and it's in line with the Data Strategy Act for fair use, especially when it's public use. Now, since you are turned it to me, let me add an important point on this. Huh? So the question is how do we support a fair innovations? I mean, we're being discussing about the startups, right? So and access to data. Now, the fact that we do have a piece of regulations that allow everyone to ask and then get a permit to use data allows everyone to get access to data, you know? So everyone means that if you want to experiment with a new technological approach to AI, whatever that form is, with multi-expert systems or not, you may actually go after the data that you will need to take a lead. So it is, in a way, let's say, that part of the game that covers the fairness and in access to use that is also that we are after with the regulation.
Thank you. So talking about industries, what would you see, maybe Eric and Bakul, whoever wants to talk about it, with the role of public and private collaborations? It seems to be the key to many problems. So, and what role should it play in the EHDS? What's the ideal model for companies like Google to work with regulators and policymakers to ensure EHDS leads to?
I have a confession to make. I'm an ex-regulator and joined Google only 2.5 years ago. So my orientation is also very much in the public health sector. And I'll tell you, one of the things that Google does really well, we have an entity called google.org that actually funds public-private partnerships. We, in France, last year, actually 1 year exactly from today, in January last year, our CEO announced a new AI hub for innovators in Paris last year. So these are the kind of things that industry can sort of set up to sort of funnel some of the research that they're doing. We also published open source models. For example, just one of the very much talked model is the Chest X-ray Foundation model. That usually, if somebody started from ground up, it would require many data sets, millions of data points to sort of train it. But the foundation model would require a fraction of that to train to the final use case. I think those are the kind of things, not just about shaking hands and having a memorandum of understanding, but also making it practical for people, industry, and especially large industries to sort of set up ecosystems, which is one of the biggest things that we are trying to figure out is the researchers, the clinicians, the innovators, the developers, can we bring them together to sort of help them bring that next level of innovation that can happen? That's one way to think about it. The other thing is doing practical applications in the space that will enable the ecosystem. This is not creating and enabling are the two pieces that I feel like if there were joint hands between public and the private could actually make this much more powerful.
So just I'm going to give you, just want to talk about open source because okay, open source is great, but there is a major problem in health, is that data is so sensitive that we know it is hard to open source algorithm that has been trained. We all hear about LLMs today. Any LLM, French LLM or whatever European country LLM that has seen during the training some medical report, personal medical data, you cannot open source it. That's a very huge difference between Europe and the US, for instance. So,
yeah, I think it has to start with the de-identified data set to get to the insights before you actually talk about pseudo-anonymized or anonymized, right? I think where anonymized is the too extreme, but de-identified is somewhere in between pseudo-anonymized and anonymized. That's how I think about it. Because I think when you have learnings from that data that can be transformed into creating foundation models, I think those are really well sort of done. You can build, so think about the pyramid. If you have almost 80% of the pyramid done with the foundation model, which is open sourced, the last 20% can be led to this personalization that can happen with private data or personal data and in healthcare. And I think that's where the difference is going to be. I think that is a solution to think about.
Okay. Eric, please.
Thank you. So building on everything we've been talking about so far, fundamentally, and this is where I think the HDS is going to really help from a European perspective, we need to define what is the pre-competitive space where organizations can build on that common foundation and then compete in the areas where they are particularly good. We learned in other industries, banking does this. I can take out money from any bank machine anywhere in the world. That's fine. They collaborate across private entities around because they realize the good that it creates to customers. Airlines do this because we can fly any airplane to any airport in the world. We can, and then we have consumer goods and other things where they are designed to work together because they agree that it is more important to collaborate on common foundations, and then they can compete where they want. That means that they can spread out the cost of building that foundation and then compete and invest in the areas where it makes most sense. But we haven't done that in health. In health, we tend to try to compete on everything top to bottom, which is why we have this massive fragmentation across all of our various assets. So we haven't incentivized, to go back to the question on incentives, we haven't incentivized the creation of trusted health networks. And that's where, again, the HDS, I think, really comes into play. But we need to recognize that incentivization involves the investment in individual institutions that build the first part, and then people leverage the investment that they make over and over and over again. And when we do that, we create economically a J-curve, where at first it is more expensive doing it that way, but then you get the exponential growth. So we need to be recognizing that the cost model of doing a more foundational approach to this will generate more benefits in the long run. We have lots of evidence from this from many, many other industries, but we have to do that initial investment of setting up the initial foundation on which we can all collaborate, so then we can individually compete in the spaces where it makes sense.
Joni, you want to?
Yeah, excellent idea. Thank you, Eric, for that. And you know, there was actually an incentive going into that, aspect of things. It was led by Sitra, Finnish think tank, and you mentioned the banking world. That's why I was thinking of Sitra, and in the banking world we have IBAN system, and the Citra's idea was IHAN, which is H for health. So there was already an incentive regarding that aspect of doing things that Sitra tried to push for a couple of years. And regarding AI models and open source, I'm always talking about Finland. Well, I'm Finnish, I want to advertise what's been developed in Finland so they could be utilized in Europe. There's actually, in FinData, they have a process for AI models, because AI models, according to the European Health, I'm always talking about European Health Data Space, European Data Protection Board, in their opinion, AI models usually contain personal data. So FinData has developed how to make sure when AI models are being developed in the secure processing environment using health and health-related data, so anybody can't be re-identified. So they already had a process for that, and that's something other member states could use and utilize, and something to think for them probably the ESDS board as well. So we have these processes, we have these incentives in Finland, and certainly here in France, similar ideas in the Health Data Hub. So that could be used to tackle this sort of data privacy and data protection concerns that are related to using the health and health-related data for primary and secondary use purposes.
And just to add on that and add on what Bakul was saying, so there are a number of emerging privacy-enhancing technologies that are coming into play. There's an event that's happening at the same time at the OECD offices where they're talking about the importance and the evolution of privacy-enhancing technologies, and I think there's a huge opportunity for us to apply some of those innovations in a health context to ensure protection while also ensuring use.
Thank you. So moving to David, from a practical point of view, what role can WHO play in helping, or could play in helping regions without strong data infrastructure?
Thank you, Emmanuel. So coming back again, right, to the basics.
Yeah.
Data infrastructure. I could mention several actions, right, but I would like to focus just in three very quickly. Please remember that when you digitize a broken data process, in return, you have a digitized broken data process. Right? That is the reality. So something that we work a lot with the member states and with the countries is how we can conduct health information and data assessments and how data is produced, collected, and used for policy decision making. And we are so proud that a year ago we signed a multi-donor agreement with the European Commission, with DG SANTE, to expedite this work in the WHO European region to really enhance all of this. And that is very needed. You need to know how your data is for them to be used for policy decision making. That is one. The second is about networking. This is an area of work in which we are not sharing enough. And the same happened with digital health overall. We should share more the failures, particularly the failures. We are so proud about the things that are working well, but then we are shy when we need to really share what is not working. And that is what we really need. And that is what we are trying to propose and move from WHO. And then, particularly when I am talking about this, about networking, is because we need to address the elephant in the room. That is how we address the public needs with the private interest. And this is not a criticism to the private interest, please don't get me wrong. But there is a disconnection between what the public sector needs and what the private sector is developing. Sometimes there is some alignment, but overall there is a gap in that discussion. So a few months ago, we established the Strategic Partner Initiative with more than 100 institutions, and we are talking about this, how we can really bring countries with private sector to really talk about this. And finally, about capacity building. When we are talking about data, we are talking about people, right? And the skills are not there. Sorry, but I'm going to insist a lot about that. So I really appreciate the curricula in health science, in medicine, in nursing, but we really need to shape the curricula. And we are late, very late. I respect history of medicine and all these subjects that are very important, but we need to move from a digital world and an AI age, and it's still work in progress.
Thank you very much. So I would have the same kind of question for Eric. What practical steps can OECD countries take to ensure AI doesn't deepen existing healthcare inequalities?
So in that way, well, first of all, I'll say thank you, Marco, and Lorena for your earlier comments, recognizing that one of the unique attributes about health and health data, especially in an AI world, is that it represents both public and community interests simultaneously. And finding a way of understanding how to balance that is important. Public and individual protection is easy. It's often done through consent. But community interest is a challenge. And that's where one of our recent upcoming reports, we really reflect on consent, using consent as a legal basis for secondary uses of data, especially in health system protections and safety and health system improvements. Consent doesn't work that well because it's public interest, it's community interest that really is important. So the question is, how do you calibrate to what community interest is? And I need to look no further in that than France. Because a couple of weeks ago, I was at the report out from the third year of activities of France's Citizen Assembly around digital health. And in that assembly, that, as I said, existed for several years now, they were able to report back on how they had made more than 50 recommendations, of which more than 50 were accepted by government and integrated into France's plans, and certainly some of the work that you've been doing, Emmanuel, around the Health Data Hub. So there is a tight relationship and respectful relationship between the public and the implementation of digital health and tools. And the public can meaningfully say, this is how I expect my data to be used and how I want it to be protected. So I'll reflect on two things very quickly. One, there was a woman in the UK who told me that I don't care how you protect my data, I do care how you use my data to improve my health and how you improve my health in my community, and while you're doing that, assure me that my data are protected. So this is what the public says. And similarly, a report in Canada identified, upon a survey of the public, there were 3 areas where public had consensus: use my data to improve my care, use my data to improve understanding of disease, use my data to protect the population. And if we actually all agree on those things, which are fundamentally, I believe, most of the public would agree on, then let's get out of the way of making that happen. Let's simplify that while ensuring that we're also protecting the data.
Thank you, Eric. So now it's time to move to the third round of this roundtable. So to tell you the truth, on my note, I called it the AI battleground. Okay, I think there are battlegrounds at different levels. We talked about innovation regulation, ethical AI, need for rapid process. This is another battleground. And of course, big tech's dominance in the industry sectors making it harder for small startups. So it's full of questions. I don't know what to start with, to tell you the truth. Maybe the industry should start. So regulators say AI needs strong oversight, but innovators say regulation kills speeds. This is something that we hear everywhere. Trump's canceling Biden executive orders and on the road to deregulate totally AI. Comment on that and tell us what you think about all that.
You don't want me to be fired from somewhere, right? As an ex-regulator, I can tell you, like, every time somebody told me, like, innovators say that regulations kill, I would probably be a very rich person by now. I think that's the right, I think the approach about balancing innovation and safety is the key part of regulations. And if you start thinking about it from that angle, I feel I could speak for my company, that we agree that regulations are important because it sets the standard for right behavior. And I think that expectation of right behavior is going to be there. I'll also flip it around and say that the challenge is not about regulations and the intent of the regulation. The challenge is in the implementation of the regulation. When the rubber meets the road, and when a person is trying to go into getting regulatory approval, and all the things that needs to be climbed to get that done is the real challenge. So I think if regulations can focus on simplifying those interpretations, so the people who are executing on implementing those regulations are sensible in a way that it actually makes life easier, and with the intent of the regulation, I think that would be a phenomenal thing. So I don't think the innovators are saying regulation will stop innovation, but I think it's the last mile of implementation that matters. I think that's the key part that needs to be sort of solved for. You asked a question about where the world is going in the US with the deregulation stance. I feel this is exactly the point I was making, is the implementation of the intent is the challenge. And by the time it gets down to the front person reviewing a particular solution, it is interpreted in a very different way than what the original intent was. And I feel like looking at a positive side, I think there's probably an intention to reset some of that. In software world, you'd call it refactoring the intentions to some degree. And that's kind of, I feel like that's what's going on. I think at the end of the day, not a single industry person will stand up and say that, oh, I need to make bad products today. Let's just, harm some patients. That's not the point. So I don't think that's the intention. So I think if the regulations start with the same concept as industry, and if they're both on the same page, then creating a standardized way of approaching this and the intention would actually matter.
About big tech dominance, should the startup be afraid of big techs?
I think open source is the way for all. You see, almost all big companies are putting out open source models. And I think, but I don't believe, and actually this is just my personal opinion, I don't believe startups could have done what has been done today with the amount of energy and resources it took to get to where we are in Gen AI. And I think the result and the fruit of that is through open source model that all the companies are starting to share. And you can see pretty much every big company is having some version of their open source model out in the marketplace. That is the innovation that I think would be allowed. And I think we should probably promote a lot more of that. Some companies are naturally oriented, some companies are not, I think, but that's kind of the way I would sort of think about it.
Yeah, then we should be discussing about the levels of open source, because there are many, many levels, and we all heard about the DeepSeek that was fully open source, so from the training data, from everything, so that was kind of a big...
Yeah, can I just talk
sure,
1 second? So not about that particular company, but I think this is where regulatory guidance would probably be helpful. Like, what is a good open source framework look like for health? I think in general, we can't control the entire industry and the entire world, but at least in the health space, where is a lot more safety critical issues can arise if things didn't work properly. I think that's where we need to sort of make sure that it is actually grounded, it's factual, it's actually some rules of the road that can go. And also in Marco, I think this is an incentive part, the conversation about can the life be made more easier for people who open source and build, or people who build solutions on top of open source. So what does that look like? I think those are the kind of things that I would start thinking about.
So Marco, how can EHDS keep up with all these very fast AI developments and deregulation in the US? And
well, certainly in Europe, we will, this is the case for the European data space, we build that regulations on values that we share at the European Union. We know the story, and these are very clear to everyone. No? The GDPR, you didn't mention, I mentioned it. The GDPR protects the privacy of people, and we build our systems on the basis of privacy of systems. Now, you can say there are hurdles that are attached to that. I can tell you that if you develop a data protection impact assessments from the scratch, you get solutions that is trusted by those who are going to use it. And this is not just made up. If you go back to the COVID certificate, this was strongly routed on a privacy, and by the way, an open source model. An open source model technologically, because at that time, by the way, we were doing something that we didn't know how to do it, so nobody gave us the book. So we went into an exercise and they said, let's use the power of the community to check whether the security issues or the privacy issues are, say, well taught, and that helped us a lot. But this doesn't mean that that is the best model. No, there are solutions that are there that can use other systems. Now, for the European data space to deliver, say in this world, I would say that certainly it will need, to continue its focus on the trusts and values. And let me say, but I don't know how many people here have developed technological solutions or are really, attached to AI systems. But Yeah, sorry, maybe technical, but sorry, allow me that. Say artificial intelligence is not a new paradigm, and I see Regina here. I mean, all those radiologists that have been using AI for ages, they know we are not inventing anything new, full stop. Where we are inventing solutions is because we now have access to a capacity of computing capacity which we didn't have before. We do have technological solutions that generate solutions that we didn't have before, and that is the challenge that we have now. Now, let's take these solutions and let's talk about the role of a medical device that mediates decision-making processes. So different compared with the past, if you have a relation between a doctor and a patient, a medical device will provide data, and then the doctor would say act on the basis of that evidence/data. Now we are entering into a phase where the technology behaves like an agency. And you know, it calculates risks. So for instance, the risk of re-hospitalizations. Now, there are questions that are coming out of that, you know? So should the doctor reveal what the system says about the risk of re-hospitalizations? And this opens an entire discussions in the fold. But the real thing is, do you want that systems that goes into the market to be tested before it goes to the market? And I think that safety for us is at the forefront. So the way in which we will be developing these technological solutions will concede nothing to safety, because that is what is important. And for those who play with these technological solutions, you may have seen in the past applications to scan your needs and check whether this is a melanoma or not. You know, for decision making, that is a problem. And the way in which that data it is also collected, it's part of our equation. So we need to put, I believe that putting together the backbone of accessing data, which is variety, but in a way that it's controlled and privacy respective, with a solution like the AI Act that manages the risks that are attached to the new technological solutions that are emerging, and opening up to computing resources, it is the path we will be exploring in, working with the futures to deliver on our ambitions, let's say.
Thank you. So we discussed about AI regulation. Now, from a global point of view, global AI regulation is a mess, right, today? So David, maybe, and maybe after Eric and Joni, but should AI in healthcare be regulated globally? And if so, how? And can Europe set the standard for ethical AI beyond its borders?
Thank you, Emmanuel. So let me share some data points about governance, about AI, right? We just conducted a survey on the status of AI for health in the European region, in these 53 countries. And then, so interesting, with, for example, you're looking at AI and ethics, only 9%, 4 countries have guidelines on AI and ethics, right? In we move have a national vision, national strategy on AI for health, also only 9 have strategies, and 16% are developing at the moment. So when we are talking about regulation, we also need to look at the basis for AI at the country level, right? I am very convinced that the EU AI and the European Health Data Space are the necessary tools to advance at the global level. But I think that Bakul mentioned this, right? We cannot use this for everything, right? It's going to be difficult that you try to scale because there are different cultural differences, high-income countries versus low-income countries. So there is a lot of potential. It is true that as WHO, as a neutral party, it's true that a lot of countries beyond the European Union look at the European Union, and that will continue, right? That is not going to change. So I think that this is giving a very good momentum for the European Union to lead the way at the global level, knowing that this will be, of course, adapted to the different circumstances depending on the country.
Thank you.
So, absolutely agree with everything David was just saying. My take on regulation is ultimately regulation provides clarity. Clarity is kindness for the people who are implementing these various solutions. Having said that, the challenge that we have is that the regulations we have, when I talk to many innovators, they say it's confusing, it's difficult, there's duplicative, it is repetitive. I have to do the same thing to 5 different bodies, and the amount of time it takes me to navigate the regulatory systems are so expensive that it stops me from wanting to innovate at all. I do not have the cost basis to navigate the regulatory space. And this is where, from the HDS perspective, I have a lot of respect for the path that we're going down around the data access bodies and simplifying that process as a whole. From an overall regulatory perspective, I think if we look at what the regulation is around medical devices, and we look at the delta between what that is and what additional actions you need to take to regulate artificial intelligence, I think that that gap is maybe not, well, I will call it vanishingly small. It's not nearly as big as people think it is. If we recognize that a lot of the regulation we do in health is a medical device, then we need to think about, well, what is the difference, and is that difference reasonable, and how do we make sure that that fits within our current medical device regime? Equally important is to define when AI is not a medical device. So we make it clear, this is the pathway that you go down when it's not a medical device, and this is the pathway you go down when it is. The default tends to be, if it touches people, then it must be medical. But I think that there are opportunities for us to streamline that between the good, tried and true processes that we have around medical devices and the opportunities we have to streamline processes that are just improvements in overall efficiency and system effectiveness.
Yeah, Joni, please.
Thank you. I think a lot has been actually done globally regarding the use of AI and respecting basic human rights. I mentioned the convention from the Council of Europe, where Council of Europe countries and other countries as well, third countries like United States, Canada and UK took part in that work as well, and many other countries. So there are initiatives regarding that. And then there are enabled legislation in Europe like the AI Act and ESDS, certainly. And I think it's a positive thing, you know, how can we gain that advantage, competitive advantage for Europe is that we have this regulatory framework enabling to do things in a data protection and data privacy compliant way, and taking into account basic human rights and ethical aspects as well. That's the competitive advantage. Yes, there are lots of different regulations and laws that we had to read at the same time. Even I, as a lawyer, understand it's the landscape is the legal landscape is quite difficult to understand, and you have to read many regulations at the same time and come to some sort of conclusion. And even with the ESDS, it's a challenging legislation, even though I took part in the negotiations. I could say it's an easy act, but if somebody reading it could have different interpretations. And there's nothing wrong with different interpretations. Like in the negotiations, I said, if I were to ask you what this data category means from you who are negotiating 27 different experts, I would get 27 different answers. That's not a problem. You can all find, you know, interpretations that enable things. So I really pay attention to enabling things. And regarding the EHCS, which we actually started from, there's actually in the eHealth network plan for 2025, we're going to enhance the legal work group that will try to find unified legal interpretations of the ESDS. So we're doing that work to help the different member states. But I wouldn't be that worried about different interpretations of legislation. Be bold and try to find things, how to enable things, not just to stop doing things. We have the same discussion in Finland, why AI is not being used in certain areas or by certain healthcare providers. It's because they're scared of making, you know, bold decisions how to interpret the legislation when they should be looking at possibilities and enabling things. Of course, taking into account data protection and privacy aspects as well as human rights and ethical aspects.
I love what you just said about being pro-enabling rather than pro-stopping. I think that's the problem that we need to sort of all collectively work on. From a global perspective, I just wanted to provide some my observations that's happening. And you started the question with global AI regulations is a mess. I feel like it's more of a bipolar sort of situation where you have certain countries being pro-enabling, hence less regulation and allowing more freedom for innovators to go. And certain countries are becoming much more regulatory perspective to probably enhance regulations to make sure that it's throttling some of what goes in the market with making sure it's perfect. So I think there's obviously not one or the other. Somewhere in the between is probably the answer. But at the same time, I feel like if you were to continue this trajectory where there's divergence of pro-enablement and pro-stopping and making perfection the enemy of the good, you will end up creating innovation silo or deserts or technology deserts that may actually be driving the disparities that Eric started to talk about. And I don't know, it might flip. It might flip the other way around, where some countries, like I would not name names, but the under-resourced countries are actually don't have any infrastructure to regulate. And they may actually allow a lot more experimentation to happen than over-resourced country. And I think this is the challenge to think about, how we sort of think about it going forward.
Yeah, so it's a question of money also, right? Because it costs a lot. AI development is costing a lot, so the biggest players control all the data pipelines. So Eric, maybe a word on how can we prevent AI in healthcare from becoming a race only on the richest countries and companies?
Well, it's already a race. So preventing it is hard. So it's more or less how do we address the fact that it's a race while ensuring there remains to be focus on public interest and public outcomes and what we're trying to actually achieve around health, which is to ensure, well, effectively the sustainable development goals as it relates to that have been agreed many, many years ago. There are a couple of areas. So one, I totally agree with you. There's an opportunity for the less resourced countries to leapfrog better resourced countries because they have no legacy infrastructure on which they feel burdened. Much of the problem that we have across certainly OECD countries is that we've made billions of investment in legacy infrastructure where we forgot to invest in the data foundations, we invested in the technologies, and as a result, we've created this massively fragmented mess of solutions, and we're now realizing that we can't achieve what we wanted because we never invested in the appropriate data foundations across countries. But I have some, I don't know if it's good news or not. So there are at least 3 low-hanging fruit, and this is riffing off of what David was saying before, that one of the things we have to do is realizing this is not an issue of making paper processes digital. This is about re-envisioning the system as a digitalized system. And there are 3 major opportunities in a digitalized system. One is improvement of productivity, and we've already heard, oh, productivity gains, yeah, but it's real. Like, look at Netherlands. They've declared that they are going to try to reduce administration by frontline health providers by 50% in the next 5 years. So they are making serious strides around how to improve productivity of frontline health workers and thereby create additional capacity and ideally get people away from looking at the back of a screen to getting to a place where they're talking with patients again and providing better care. So that's one area. Second area, a little uncomfortable to say, but it's fraud. There is a massive amount of fraud that happens in a paper-based health system. So what are the opportunities to reduce fraud? Some estimate fraud as high as 30%. So again, what are opportunities to reduce the unnecessary testing, the unnecessary visits, the unnecessary treatments that are both expensive and wasteful and potentially cause harm to the patients? And then the third area is something riffing off of what Lorena briefly mentioned this morning, which is diagnostic error. We're about to produce a report that estimates that the cost of health systems for diagnostic errors is 17% of budgets. Why do diagnostic errors occur? Because the right people didn't have the right data and information and analytics at the time they were making the decision. What is good at creating the right data and information in the right place? obviously, around AI. So what are opportunities for AI to reduce the amount of diagnostic error that we have in the system, to reduce the unnecessary testing, improve the efficacy of treatments, and reduce the overall readmission and the reappointments that are absolutely unnecessary? If we do that, we can materially use our investments in AI to reduce some of the baseline costs of the health system while improving its effectiveness, efficiency, and ultimately better health outcomes for all.
Okay, thank you very much. So my team is making me signals saying we are running out of time. So I know, but no, it's not your fault. We started late, and it's not every day that we have such high-level panelists on such a very crucial subject. So I don't mind shortening the pause. I hope you don't do. But okay, let's conclude it. So just one sentence, each of you. About what is, if I ask you, what is the single most important step needed at the European Union or global level to unlock AI's full potential in healthcare while maintaining trust and equity? David?
Thank you, Emmanuel. So I would say that continue strengthening health workforce. I think that AI, less than 1 minute. AI will not replace humans in the health sector, from my point of view, and I really believe it. But those with the AI skills will definitely have advantage to those who do not, right? So we are facing a new literacy crisis. Back in the days, reading and writing was a luxury, for example, for my parents, that they didn't have the chance to go to university. So now with AI, we are creating the same problem. So we need to prepare for that. Thank you.
Well, for me, it would be easy because the answer would be the European data space. And in analyzing this, I think that in the years to come, the challenges is to implement the provisions across the member states and making sure that we reap the benefit from having
I would end with saying that open data standards are going to be much more critical going forward with all the exchanges that sort of lie. I think we have standards already, but we need to sort of make sure that people actually use them. And then I think clear privacy laws. I don't even know the word secondary use is real in the AI space. I'm going to stop there.
So riffing off good old expressions, if you want to go far, go together. If you want to go fast, go alone. But we can't go alone. We have to go together. But we also have to go fast. So we have to learn how to go fast together. And importantly, that's where things like open source, that's where driving, addressing the fundamental cultural problems that we have to do to ensure consistent interpretation and avoid the harmful variations in misinterpretation of what we want to achieve from this overall set of innovations.
Joni?
Thank you. Like it was mentioned, what's important. Like Eric said, what we have now is AI. It's an enabling tool. It's just a tool, but we have lots of potential for using this tool. That's one. Then we have enabling legislation that was mentioned here. We have the European Health Data Space Regulation and AI Act and other regulations as well. So we have 2 enabling tools now. Then, like Marco mentioned, the challenge of implementation. And with that, I mentioned before that in order to make it happen, we need to do cooperation. But really, in order to have the full potential of AI is that in the implementation of these enabling tools, each and every one of us understands what these tools means and how to interpret the legislation, how to really implement to get the full potential of the AI. So that's what we actually need in order to make it happen.
Thank you. So we have 5 minutes to take questions. I think this is important. Are there any questions? There are questions online, but are there any questions in the room? Yep.
Hi. Great talk, thanks a lot. I was just curious about redistribution of money, right? Because you talked about, the public and private partnership, but at the end of the day, it's citizen data, it's citizens who pay for health. And in France, we're lucky that it's covered by state, but not everywhere, right? So how do you see that as well, right? Because at the end of the day, it's each of us contributing to make health better, right? No, just all of you, sorry. But I mean, both from an economist standpoint and also public and private. I think it's a global answer.
I think I'll go back to my statement on value, right? I think we have to be very clear when somebody donates data, I'm just calling it donate, contributes data to the system, what are they going to see? And what are the downstream results as a result of they having the data accessed by others? I think those, and this is not just the patient, but also across the ecosystem, that translation of work that becomes knowledgeable to the people who are touching that information is going to be really, really important. And I think healthcare is like notorious, right? And you go to a doctor and the doctor writes some notes and scribbles and hides them from you and don't tell you what it is and just gives you enough information to go take a medicine. I think the value of how the doctor saw that information becoming helpful for them is going to sort of drive sort of the conversation.
And one of the other opportunities that we have, much as we've done in virtually every other aspect of our lives, where, you know, I do banking on my phone, I book my airlines on my phone, but I don't do anything for health on my phone. So how can we collectively engage the public meaningfully in the health journey? We do things like bookings for Dr. Lib, but what are opportunities like in Finland where patients materially improve data quality? Because data quality is a major issue. The best people to improve data quality is the patient. So how do we engage them in that?
Maybe I could continue from our side. You know, data donation, as mentioned, as a principle, is a great idea as well. And the principle in healthcare, like in ESDS and like Finnish legislation and other legislation in Europe, you know, it's actually mandatory that you register the data. So in order to provide you healthcare, it's legally mandatory to register the data to be utilized for that healthcare purposes. And of course, if you talk about secondary use purposes, there lies lots of benefits that will just not benefit that patient, but will benefit the whole society. It will benefit the enterprises as well. It will benefit all of us, me, you, everybody. So that's important to understand. And what I didn't mention early in the panel is also, if my data is being used for example, for scientific research. And you mentioned, Emmanuel, the garbage thing, that, you know, garbage in, garbage out. But, you know, when you're actually doing the scientific research, then, like in a year, as mentioned, the possibility of enriching data. So you can return the enriched data to the healthcare provider in order to not to have garbage anymore, but, you know, enriched data. So there are lots of benefits, and the benefits in the future will be personalized healthcare, personalized medicines. So that's the next thing actually after the ESDS. So if you just donate data or your data has been registered, in the future you will get personalized medicine, personalized healthcare, and that's a direct benefit to you, and it's a benefit for all of us.
Thank you. We'll take another one.
Didier Cornel, HEALS, Healthy Life Extension Society. Thank you for your explanations, especially Sutherland for speaking about danger not to use AI and data. That's very important. And my question is to Marco Marsella about the EHDS. So it will appear in, or it's already appeared, I don't know, in the official journal those days. The legislation, sorry, is extraordinarily complicated. Only to understand when you can opt out and not, it's very complicated. And it will take years before it is really in application. So my question is, what are for you the tricks for countries who want to go faster than what it is compulsory to be able to exchange already health data between, yeah, let's say we could imagine, for example, France, Belgium, and Spain, I think, where there are people of goodwill, knowing that, for example, in Germany, there are many problems?
No, thank you. Thank you for the question. So first of all, say the first thing is that we will be working on a question and answer or FAQ that simplifies the reading of that legislation. This is what I take from your first comment. We will do it. So, but what is interesting is that the early adoption, yes, it will take some time before, say, it gets the full set of documents or the specifications to be adopted. But, say, for instance, on primary access to data, which essentially means the data about myself when I, as an Italian, I go in France and I show, for instance, my patient summary. Here, the digital infrastructure, it is already there. So the countries that want to start engaging, they can do it on a voluntary basis for primary use. And for secondary use, I think that we have a lot that we can do by low-hanging fruits that we get, for instance, from research projects. So take, for instance, the Cancer Imaging Initiative. I'm pretty sure we'll be talking today about that. If this kind of experience are used, say, to advance the way in which we start accessing the data, say, for instance, working on how AI can, or models can actually be depicted in such a way that we can use that data in line with rules of the European Health Data Space, we will go towards its implementation and streamline in a gradual step. So I actually believe, or we actually believe, that this is the way forward, so that we will, through support and incentivize these kind of initiatives and support, that we will advance the implementations of the secondary use of data. And for primary use, I think that the infrastructure is there, so for engagement, it's already ready.
Okay, thank you. I'm sorry we cannot, there are many questions online, but we don't have time, and I want to keep time for the pause. So I really want the audience to thank these, all the panelists. Thank you very much. Thank you. And so this is the pause, and before the second roundtable, which will be about how can we make it practical, so how AI can be practically useful for patients.